Emily Tato is back to doing what she loves and does best, running, swimming, and biking. She's a triathlete training for her first professional competition.
And breathing hard, but in a good way, it's a great feeling. So it's exciting to be out here again.
It's a big change from most of the last year when she was immobilized by COVID-19. At first, she didn't realize she had the virus.
All of a sudden, I started just like getting really fatigued and failing my workouts.
She was seeing a doctor for an unrelated injury when they made the connection.
And they're asking me all the COVID screening questions. And I'm like, yes, I have a constant headache. Like I feel, nauseous, tired, all this stuff. So they put me in an isolation room, COVID tested me.
The test came back positive. She had COVID-19.
Yeah, had no sense of smell, constant headache, fatigue, all of that stuff. If I would get up and walk from the couch to the kitchen, I would feel like I needed to sit down.
She quarantined and rested for 2 weeks in April and thought she'd beat it. Determined to build back her strength, she started exercising again. But month after month, it continued to be a struggle.
I could probably only run from about here to that tree before being really gassed and needing to stop and catch my breath. Like had just totally lost who I used to be, and I was kind of worried that my identity as an athlete was going to be kaput.
Emily, who is a physical therapist at Spalding Rehabilitation Hospital, reached out to her colleagues for help. She underwent a battery of tests. The doctors found she had inflammation in her lungs. After 4 months, even with the body of an accomplished athlete, COVID was still wreaking havoc on her health.
I think we're still learning why people are having persistent symptoms.
Dr. Jeffrey Schneider is one of the lead physicians to launch the COVID recovery program at Spalding Rehabilitation Hospital. He says more than 3/4 of the patients in Spalding's COVID recovery program were never hospitalized for the virus. Despite that, they're still experiencing longer-term symptoms that can range from fatigue to nerve pain to cognitive issues like memory impairment.
I would say that COVID does not discriminate. I've seen those people who are young, who have no medical problems. I've seen them have long-term symptoms. It's real and it can happen to anybody.
It's not a black and white. There's definitely a scale in between. And anybody can have lasting effects. Nobody's immune to having lasting effects.
Dr. Schneider says they're seeing results with simple health and wellness interventions like diet, good sleep, and exercise. And he wants people to know there are programs, including a new peer support group at Spalding, that can help. Karen Anderson, 5 Investigates.